Whether it's a GP appointment, a diagnostic test, a scan, surgery or physio, much of the NHS only functions Monday to Friday. The government wants Saturday and Sunday to offer the same access to care, the world's first truly 7-day health service.
Diseases don't work weekdays 9 to 5, and so neither can we. When you sat through a night in a hospital watching a loved one and praying for the morning, when you spent a weekend longing for the week, you know just how important these changes really are.
It's an ambition many applaud, but there are real worries the government aims to slash staff pay to achieve it. Currently, hiring a locum GP to cover a weekend surgery costs 20 to 25% more, while hospital consultants get 33% more compared to when they work a weekday. Nurses get 30% more for a Saturday shift and 60% extra pay for a Sunday. The fear is these premiums for working antisocial hours will be cut, and today the largest nursing union warned that could lead to industrial action.
Nurses have had 5 years of pay restraint. What we want to see is nurses properly paid. So any thought of cutting wages really would be the most unproductive way forward.
It's not just the current workforce that needs to be won over. Making a 7-day NHS a reality will need more doctors and nurses. And the additional money the Tories have pledged to pump in, rising to £8 billion more per year by 2020, is only enough to keep existing services running.
Extra money will first of all have to go into reducing deficits and sustaining existing services. It's a very open question as to whether there'll be sufficient money left over to fund these new pledges like 7-day working, welcome as they undoubtedly are.
Patients admitted to hospital at weekends are more likely to die than those who arrive on a weekday. That is rightly seen as unacceptable. But trying to tackle that with money already so tight could put the government on a collision course with the doctors and nurses who keep the NHS running. Catherine Jones, 5 News.